Hello everyone, I'm Anastasia, signing in from NORAS. In our previous session, as we have discussed about the two methods that we can adopt in order to facilitate bowel elimination, which is by passing a flatus tube and through enema. In this session, we will be dealing with the third method, which is the suppository. A suppository is a medicated solid formulation which is prepared for insertion into the rectum. Here, once a suppository is been inserted into the rectum through the anus, the temperature of the body will liquefy this medicated solid formulation. The main goal of providing a suppository is for the medication to be successfully introduced into the rectum, as well as for the patient to experience the intended effect of the medication. Administering of a suppository has several advantages, such as it can exert a local effect on the rectal mucosa. It can be used to promote evacuation of bowel. It also can be used to avoid any irritation to the gastrointestinal tract. It can be used in an unconscious patient. It can be used for the systemic absorption of drugs as well as to avoid the first pass metabolism. It can be given to babies or older adults who cannot swallow medications. It can also be given to the post-operative patients for whom administration of oral medication cannot be provided. And it can also be given for patients suffering from severe nausea or vomiting. So these are the various advantages. However, there are certain disadvantages of providing a suppository as well. The first is the problem of patient's acceptability. Here, since insertion of a suppository must be done from the anus, so some patients might not be willing to do it because of embarrassment. So here, that is the reason. This is the main disadvantage. A suppository cannot be provided to a patient suffering from diarrhea, as well as if the dosage of the medication to be provided is too large, then it may cause irritation. And sometimes if it must be provided in a greater amount than reasonably, then it may not fit into one suppository. And while providing this, incomplete absorption may also be obtained, because when we provide a suppository, it usually promotes evacuation of the bowel. So because of this, an incomplete absorption can occur. So these are the several disadvantages. Now, when we talk about the types, here there are 4 types of suppository. The first one is the rectal suppository. The second is the vaginal suppository. The third is the urethral suppository, and the fourth is the rectal fluids. These rectal suppositories are 32 mm or 1.5 inches in size. They are cylindrical in shape with one or both ends tapered. These rectal suppositories are 32 mm or 1.5 inches in size. They can either be cylindrical or bullet shape, and in these rectal suppository you will find that either one or both ends will be tapered. And if we have to talk about the weight, then this rectal suppository usually weighs 2 grams. However, this may differ depending on the density of the base as well as the medicaments which will be used in the suppository. So as I have said that usually the suppository is 2 grams, but this is for the adults. If a rectal suppository is to be given to babies or to children, then it will be half the weight of the ones which would be given to the adult, as well as half of the normal size. And these rectal suppository can be intended either for the local or even the systemic actions. Now, when we talk about the vaginal suppository, these vaginal suppositories, also called as the pessaries, are either oviform, globular, or even cone-shaped. They usually weigh for 5 grams. However, this may vary depending on the base as well as the medication. The urethral suppository, also known as the bogies, are either slender or pencil-shaped suppositories, which is intended for insertion into the male and female urethra. The male urethral suppository will be about 3 to 6 mm in diameter. It will be about 140 mm long, as well as it may weigh for about 4 grams. Whereas the female urethral suppository will be half the weight, the diameter of the male urethral suppository. Now let us discuss about the fourth type, which is the rectal fluid. Here, the total volume of mucus is estimated to be approximately 3 millimeter, and it can also spread over a surface area of approximately 300 centimeters square. Here, the pH of the mucus layer is reported as approximately 7.5, which is closest to the neutral in adults. But when it is for children, then we can see that it would be slightly alkaline. So these are about the 4 types of the suppository, which is the rectal, the vaginal, the urethral, as well as the rectal fluids. So again, before we perform the procedure, we must prepare the patient. Here, the first thing that we need to do is we must explain the procedure. We must explain the nature, the reason, the course of action, the effect of the medication, as well as the possible effect that can occur to the patient after administering a suppository, such as presence of fullness or even urge to defecate. We must also inform the patient about the importance of holding the administered drugs for about 15 to 20 minutes despite of feeling the pressure in the rectum. We must also put the patient in an appropriate position for this procedure, whereby we must tell them to lie on their side with their legs bent. So this is how you can prepare the patient. So before we perform the procedure, we need to arrange the articles. The articles which would be required consist of the medications, prescribed drug which is to be given in the form of a suppository, the disposable gloves, wooden spoon, cellulose square, a Vaseline or an emollient, disposable mat, a bedpan, a toilet paper, a kidney bowl, as well as a perforated attachment for the tube of ointment. So these are the articles which would be required. Now, while we are performing the procedure for the patient, it is our responsibility that we must first check the physician's order for any specific precaution. We must identify the right patient. We must provide privacy to the patient. We must arrange all the articles at the patient's bedside. And then we must place the disposable mat under the patient. And then we must have the bedpan ready near the patient in case they have the urge to urinate or defecate. So once these steps has been done, the next is we must gently wash the anus and rectum with warm water. We must dry the area. We must put on our next set of gloves. We must put the attachment on the ointment tube. We must apply the ointment directly into the rectum. We must ask the patient to clench their gluteal muscles together as well as hold it for several seconds. And we must assess the patient's response during this procedure. So here, once we have prepared the patient, once we have applied the ointment, then we can administer the suppository. Here, before we administer the suppository, we must advise the patient to take the breaths through their mouth in order to relax the anal sphincter. We must then use our non-dominant hand to separate the buttocks in order to make the entrance of the suppository into the anus accessible. And then we can start introducing the suppositories into the internal anal sphincters. Here, if this suppository is been administered to a child, then it can be done up to 5 centimeter deep, whereas for an adult, it will be done up to 10 centimeter. Here, while inserting, we must make sure that we use the index finger of the dominant hand. And once the suppository has been inserted, we must then ask the patient to clench their gluteal muscles as well as hold it for several seconds. So here for this procedure, it depends from a person to person, because there may be some patients who will be able to administer or to insert it by themselves, whereas there also may be patients who will not be able to do it because they might be scared or even anxious. So here, if a patient is willing, or if a self-sufficient person is willing to insert the suppository by himself or herself, here again it is our responsibility to educate them that they must wash their hands once the suppository has been inserted, in order to prevent the transmission of microorganisms. Whereas if a nurse is the one who is inserting it, then again for her the same thing. She must also wash her hands thoroughly after the procedure is performed. And once the hand washing is done, she must then record the procedure in the nurse's record sheet. She must assess the effect of the administered medication. She must also assess the condition of the patient after this suppository has been administered. She must also observe as well as record if a person is complaining of any painful symptoms once a suppository has been administered. If you find that a person is also having certain side effects, then it must be immediately communicated to the physician. So here the medications which we will be using in the suppository, once it has been done, we must then store back the prescribed drugs in the specified place in the medication cabinet. We must decontaminate the aids which was used during the procedure, as well as we must safely liquidate the disposable materials. So these are the various steps that we as nurses must follow during the procedure as well as after the procedure has been performed. So now here we have come to the end of this topic, whereby in today's session we have discussed in detail about suppositories. I hope you have got a detailed idea of what a suppository is, what are the types of suppository, how can we prepare the patient, what are the preliminary assessment that must be performed, what are the equipments which would be required for this procedure, as well as the various steps that we must follow when we are administering a suppository. So I'll be meeting you in my next session, where we will be dealing with the digital evacuation as well as the care of ostomies. Until then, have a good day. Thank you.